Hey guys, welcome back to 99 Everything, the podcast where we aim to maximize every single dimension of our lives because we want the best life possible. So today I'm in Oran Park. I'm in the lovely home of our guest, and our guest is a men's physique and classic competitor. He's won several state championships in men's physique.
A state and classic as well. Yeah.
There you go. So he's a bodybuilder as his main hobby. He has also done a veterinarian degree, and he is currently a dentist working at his own practice in
Campbelltown. Yeah.
in Campbelltown.
Yeah.
And with all this going on, he also has 3 children, and he balances all this, and that's why I thought he was a very appropriate guest for this podcast, because this podcast is all about maximizing every dimension. So without further ado, welcome to the pod, Ash. Dr. Ash Abdollahi. Awesome, Ash. So just to get straight into it, do you want to kind of tell everyone what your upbringing was like and what made you decide to, I guess, well, first of all, pursue the careers that you're currently into?
Good question. I guess like coming from an immigrant family,
So what nationality are you
so
from?
my dad's Persian, my mom's Filipino, and it's kind of one of those difficult ones. Like they came from poverty, so when they came to Australia, my dad was a dentist already, so he had the opportunity now to kind of maximize his future. So he had a few options on moving to several countries. He decided in Australia. I was born here a year after they got here, but the start was very difficult for them because, not a lot of money. But fortunately, Dad being a dentist, that changed pretty quickly for him. So it really was a very focused household. We were, losing was never an option,
I noticed that in Persian culture. Like there's this entrepreneur I follow. His name is Alex Hormozi. He's Persian.
Yeah.
He's like in his 30s and he's like worth $200 million.
Yeah.
And he said too, like his dad would just be better. Like there's
but
no option.
funnily enough, in a Persian household, if you're an entrepreneur, you're still... It's not.
He was looked at. His dad wanted him to take a secure route,
Yes.
and he was like, "What are you doing trying to be an entrepreneur?"
Yeah, it's frowned upon, right? So we always joke, but it's not a joke. It's true. There's only 4 jobs for someone that has a Persian parents, right? So one job is some sort of doctor, some sort of lawyer, some sort of engineer, or some sort of disappointment. so if you're an entrepreneur, unfortunately, they'll lie even oh, my son is this, my son is that, so even in my house, so I guess I fulfill some sort of doctor. My sister is some sort of lawyer, and then we got 2 engineers. So
Yeah, wow. Okay.
so stereotypically, you don't think it happens, but it happens.
So I guess it was like relatively strict. Like there was a certain level of like excellence that was required.
I wouldn't say it was even required. It's expected, right? So it's not. You weren't even told to do it, right? It just wouldn't. It wouldn't be acceptable to not be the best. And it wasn't praised either. So if I came first in the test at school, I wouldn't even say anything because it's like, well, what do you want? Like,
That's really
you're supposed to do it. You're supposed to. Like, what do you mean? Like, you came first in the test. Well, so what? Like,
Okay.
You want a medal for that? Like, it's like, that's what you're supposed to do.
So I guess that type of household pushed you towards like doing quite successful into a successful career. And would you say besides career, it also that type of mentality pushed you into like other endeavors, like
literally everything,
like sports and stuff?
Literally everything. It's like if it was a running race in the street, with your friends, you wouldn't want to come home and tell your parents you
came second.
You went first in the street. Yeah, I guess that breeds a little bit of level of anxiety. Like, so I don't think like that suits a lot of people. Thankfully for me, it worked very well because I think if I didn't have that sort of environment, I wouldn't have pushed myself because like I wouldn't consider myself the best student, the best at anything really, but like I could recognize like how hard I would have to work to be really good, and I was always willing to do it. So where I say like I would compare say my brothers and sister, like they were very good at everything, so like it just came easier to them. So
what child were you in
the first one.
Oh, okay, so
yeah.
there's even more expectations.
Yeah. And even like if you asked me when I was 4 years old, like what you're gonna be when you grow up, I would have said dentist.
Wow.
Even then there was no other job. Literally there was no job. Like that was the only option.
Well, you went to school where?
So like when my family first moved to Australia, they lived in the eastern suburbs of Sydney, and then as Dad started getting more and more practices, like they were in the southwest of Sydney and west of Sydney, so we ended up moving towards southwest of Sydney, but now they moved back to the east. So
okay.
I'm because I've taken over one of my father's old practices and renovated that, and so spending all the time in southwest Sydney, despite living in the east before, we made the move to southwest Sydney. So just to convenience work. Yeah.
Cool. Okay, so you went to high school in the eastern suburbs, and then went to.
So I went to primary school in the eastern suburbs, and then high school.
Oh, you moved back here. Yep.
Yeah.
Cool.
Yeah.
And because even though you said dentistry was what you thought you were going to do at 4 years old, you ended up doing vet first, right?
Yeah, because the funny thing is I think with everyone when you're told a certain you're almost dictated a path, the actualization of that once it becomes real, especially when you have options, I don't know if it was just a maturity level thing or something like that. So after finishing high school and you get scores to get in, went to the University of Queensland to become a dentist, and just first year just didn't like it. Like just like because you'd be the same in physio, right? It's like it was first year basic sciences, right? I think no matter the science area, it's all kind of the same. But then you have like certain subjects that are like your field, and it was just boring. Like and I felt like almost like you didn't really fit in. Like everyone was like even though I'm a nerd, I would label myself as a nerd. They were just like a different level of nerd, right? And I was just I wasn't enjoying my time. And then when I decided I wanted to become a veterinarian, because we lived on when we moved to southwest Sydney, we had like a acreage property, and we had lots of animals, and I really enjoyed being around animals, and I rode horses, and we had like sheep and chickens and ducks and heaps of dogs, and I loved being with the animals, and I transferred into vet school, and on the first day of vet school, just loved it. I loved like being outside, and the academic work was like very practically angled, like even though the basic sciences were there, but you're doing a lot more with your hands, and I consider myself more a surgeon than anything else. So like on the first week when they put a scalpel in your hand, that's cutting into live flesh, like that's like a different experience. Like some people like they do it on purpose actually to
weed you out.
Yeah, like so some people in vet school, they think it's all puppies and kittens, like so to weed out those people, they put a scalpel in your hand, they make you cut a dog.
Right. A live one.
It's actually a cadaver dog. It's there, but they make sure that you understand that
what goes into this role.
Yeah, and there's a few other things that I'll spare people the details that but some of the things like if you didn't have the stomach for it, you wouldn't do it.
I've heard like you got to help impregnate horses.
Yeah, that's later on, but like the initial stuff is like say learning a lot about anatomy. So like like you're kind of you're kind of going through all the layers of tissue. So it involves like a lot of cutting, away tissue with your hands. And some of the stuff in the kind of outside of the classroom in the paddocks and stuff like that, it's, you know, kind of laborious, and so like you realize it's actually hard work. So so some people that think that, you know, again, like the actualization of the job versus the idea of the job is different. So like you'll lose some people. One of them is like they take you to an abattoir, and you know, it's a reality of life. You know, animals get killed for our consumption of meat, and like some people, like one of the jobs in abattoir is the vet. So you have to.
What's the job of the vet? So
it's like you're inspecting the animals before they go to slaughter, make sure they're not sick, because obviously we don't want sick meat. The second thing is during the process of kind of taking the skins off and sectioning the meats, you want to make sure it's contamination free. So like the organ separation, any contamination of hair on a carcass, all those things. So like you have to be very, very okay with like live killing of animals, and you know, it's very confronting, really. Like, you know, some people didn't make it through. Some people became vegans afterwards.
I would say, like, if you I would assume most people that become vets are very like animal loving. So to be in that environment would like be like torture.
It's tough. Yeah. And then and that's actually like how I ended up going towards dentistry. So like I always wanted to be a racehorse vet, and that was, you know, because like riding lots of horses as a kid, and really enjoyed that, and also like the gym, and like, you know, like thinking like the athletes, you know, like so the horses are athletes, so like it's like what we do in the gym, like trying to extract maximum performance by nutrition, supplementation, exercise. You're doing that on a horse, right? So,
it's like exercise doctor for horses.
But like it's all aspects, like the health, the fitness, and, you know, and then you're working like with teams, like, you know, with physios and chiropractors and nutritionists, and to try and extract maximum performance. But what you don't realize is, you know, like there's an animal, you wouldn't call it, its use for our own interests.
Pleasure?
Yeah, right. So when, you know, like as people, we can say no when we're tired. We can rest, right? But like animal can't display that. So if you have a cruel trainer, or a horse is overworked, you know, and that's when the injuries happen and things like that. And you know, like you kind of, if you love animals, you see that this is not a life, you know, even though I love horse racing, but once you really see, you know, what the animals go through, you know, it kind of changed my mind to it. Also, I was working in general practice as a vet as well, so small animals too, and the reality is probably 1 in 5 animals I would see each day I'd probably put down, and it was fixable problems, not problems. Often the issues became finances, and if they couldn't afford, you know, the acceptable form of treatment is euthanasia. And, you know, if you like animals, if you love animals, that's hard. It's hard to do. It's hard to put down an animal that you can fix, and it almost makes you feel like you want to pay. And we do often, like a lot of time we will. Right. We'll use our own money, like we'll supplement their own. So people say, oh, the vet bills are huge, but like, you know, like they don't understand, like we're there to fix.
Yeah.
So they don't see like how much effort and even our own finances we'll put into saving an animal's life. And then it got even worse when I started working in emergency. And it wasn't 1 in 5 anymore. It was like 2 in 5, sometimes even 3 in 5. Like, you know, animals that you see you're putting down.
What's an example of a fixable problem?
Broken leg, right? You know, so broken leg. You know, if they could afford the orthopedic treatment, which would be nice. You know, like just like, you know, if you had knee reconstruction you need to do, you know, you could do that. That would be kind of the high level of treatment. Low level of treatment would be amputation of the leg, but sometimes they can't even afford that.
Yeah.
So like a car accident with a very fixable problem, you know, fixable fracture, if they don't even have the money for like an amputation, you can't let them live in pain.
Yeah. Would you, if you had to give like a PSA to any potential pet owners, knowing what you've seen now, what would you say?
Yeah, like owning an animal is a luxury.
Expensive. Yes.
Is a luxury, right? So you better think that, can I afford to give this animal a life? You know, a life that's worth living. And sometimes, unfortunately, things happen that's beyond your control, like sickness, accidents, and you gotta have that. Like with my own children, I'm very aware that things can happen. So like you kind of have provisions in place, but in your mind you'll always accommodate that. Sometimes I feel like with animals, it's
People
kind of
don't
an
do that.
afterthought. You know.
Ah, yeah.
And then once things go wrong, then they're like, they become a bit shocked, and you know, like, and it's kind of expensive. Like to feed a animal with like good nutrition, like with us, it's not cheap. You can feed them garbage, and get by. But you know, if you really want, and sometimes some of the costs of some of these animals, like you know, is astronomical. Like I know some British bulldogs that are like $50,000. Like
Yeah.
you know, some of these people like are spending a lot of money on these animals. So. Yeah, the cost of the animals is one thing, but looking after is another. You know. So.
Yeah, I had a friend who did vet is 5 years.
Mm-hmm.
Yeah, he quit in the 4th year.
Yeah,
with the same kind of like thought process. He was like, all these people, like as soon as it is like expensive, they're like, all right, oh well. And then he said the same thing, like there's so many problems that animals would have that were so easily prevented, or with like the use of money, but people just couldn't afford it. And then he was just like, he got super jaded.
Yeah, and I think sometimes people like see the bills and they think that like vets do it for the money, and that we really don't. Like, because the comparatively, like you could earn 10 times that if in the human field. And like I have a friend that he finished vet school but never even worked a day of his life as a vet. So he, in his 4th year, he started studying for GAMSAT, and then went straight from vet school into medicine, because he saw the same problems, and he just didn't do it. It's actually one of the professions with fastest exodus out of the profession, falling numbers, and it's also the profession with the highest suicide rate now too. So
Wow,
it's a very high pressure job. So yeah. So that's how I ended up
switching and pivoting.
Well, it wasn't on purpose as well, because my dad's a dentist. Like I was always interested in dentistry. I initially wanted to be a dentist, so I got interested in animal dentistry, and that was pretty cool, because no longer was I putting down animals anymore, you know, and you're doing cool animals now, like tigers, lions, polar bears.
Did you work with?
Yeah, lemurs, monkeys.
Wow, that's
pandas. Like it's fun, because you know, you get to in your mind when you're a little kid and you see all the animals, and the reality is as a vet, like you kind of only like do 2 or like small animals, you know, like or
domestic ones.
Yeah, or even like if you're a production vet, like you might just be cows.
Yes.
Or might just be pigs. Right?
Yeah.
So like as a veterinary dentist, you do all of them. Right?
Yeah.
So,
okay.
So that was really cool, but then I'd done like every kind of educational advancement that you could, and got to the point where is the next step for me to specialize in veterinary dentistry solely, which would have meant me moving to America and finalizing my training there, or another idea I thought was, why don't I just become a human dentist? So one day I was sitting across the dinner table with my wife, and I was looking at her, and she's like, why are you looking at me like that? I was like, I think I'm going to be a dentist now. And she looked at me and she goes, okay. And then I called my dad and I said, I'm going to be a dentist now. He started laughing because he goes, I told you you're going to be a dentist. Right. So, and then I just enrolled I was like in dental school. A few months later, and it was probably the best move I ever did, because one thing that it taught me is you need to have like like more than one skill, because one of the things that would have really hurt me was actually COVID, because as a veterinary dentist, like you're traveling a lot to different zoos internationally, like, and because there's not enough specialty work in New South Wales alone, like, you know, so you kind of got to go around. The issue in COVID is we weren't allowed to, so I would have not been able to feed my family, you know, like, you know, like it was, even though even in dentistry we got restricted on what we could do, but we could survive, right? So it's like there was still enough, like I was only doing about 20% of what I should have been doing, but it was still enough that you could get by, you know. But with veterinary dentistry, I would have been on zero, you know, because there would have been like no traveling.
When did you switch to dentistry? Like what year?
What year was that? That was 2014. So.
Oh, okay. So it was still quite a bit before COVID.
Yeah. So it was like I was very happy that, you know, like, you know, having that dental avenue to go by. But yeah, that's kind of how I ended up as a dentist. Like, kind of not on purpose. Like on purpose, but not on purpose.
It kind of came back.
Yeah, full circle. Yeah.
So you've been working as a dentist since 2014, and I guess you took over your dad's practices.
Yeah, so that was in...
There's like several practices in the Southwest Sydney area.
Yeah, so my dad had... he's like a psychopath for work ethic, right? So there's one stage, like he had a lot of clinics at one stage. So he had 6 dental clinics and a medical center at one stage. So he's a workaholic, and yeah, I saw that and I was like, I don't want to be that guy. So I have one clinic. And and I just park myself there, and I enjoy like, you know, just kind of servicing my local community, and not, you know, kind of, it annoys my dad. I'm not more entrepreneurial and not more money motivated, but like, again, I enjoy my job, and I think when you sour it with money, it becomes...
It can change how you perceive, how you do the job, I guess.
Yeah, and I worked in a lot of high volume places, so like even when I was working in Europe, like as a vet and a dentist, like, but the vet one was really curious. In the general practice setting, you only got 5 minutes with the animal, so they would triage the animal until they got to you, and then you'd get like they'd have very well trained nurses and support staff. So it was a big kind of staff roster. But by the time animal got to you, and then you just say, okay, this is the thing, and then deliver instructions, give some advice, and then move on to the next one. And then dentistry can kind of be like that a little bit too. Like it's just like see a problem, fix a problem. And I hate that approach, you know. So when I had the opportunity to have my own clinic, like slowed right down. Like if you're my patient, it's just you, right? There's no one in the waiting room. I try and, like, if there's obviously I'm not perfect, so sometimes things go over time, but if your appointment's at 3 o'clock, your appointment's at 3 o'clock, you know, like, and it's very rare that like I'll be over time. And we get to discuss like everything about your health. It's not, because teeth are one thing, but it's kind of a window into how you look after yourself. And I always say, like, my concern as a dentist is not your teeth. I really couldn't care about you, because I can fix that part, you know, like that's fixable. But like how you got there that's what I'm more concerned about, because I don't want to fix this and you pay me a lot of money, right, to fix it. And then a few months later, you're back with the same problem. And I was like, what help was that, you know? So, you know, that invariably comes with lifestyle changes, nutrition changes, sleep changes, stress management. There's like medication alterations. Like, you know, it's about changing a lot of that, so that you know, in the end, it's you know, your teeth then do become a reflection of your good health.
Yes.
It's an interesting one, because I joke about this, but it's not a joke. I always say, you know, this is the I win game. And they're like, what do you mean? I'm like, so if you listen to me, right, we both win, because now you're healthier. I'm not worried about you. I know you're on the right path. I know, you know, like your health outcomes are going to be good, and I'm not stressed. And now we're just doing reviews, and you know, you're on the track to being, you know, optimal in your dental health. And and with that being your general
Overall health. Yep.
But if you don't listen to me, I still win, because then you still pay me a lot of money. Like, you know, I say, like, and I joke and I'm like, you know, like, if you want me to have another car out there, you know, like, just don't listen to me.
Yeah.
Right? And then you'll be back, you know, like, so it's a joke, but it's not a joke. You know?
Yeah. That's really interesting, because there's a lot of parallels with the way you treat and how I treat. Cause I think the only difference between physio and dentistry is you guys, your billing is so much higher than physio.
It's true. And then, like, and our area of interest is so little. So little. Yeah.
But it's the same thing. Like, people can come in for back pain, but then I'll look deeper. It's like, oh, the reason why I can fix your back, but the reason you're like that is because you sit all day, you don't exercise, you sleep like shit, you eat like shit, and then it's this whole podcast about 99ing everything. It's like, if you look at it through a more holistic lens, the back fixes as a symptom of you fixing your general health, and it seems like dental health is very similar. Yeah,
and it's also like there's a lot of things that we judge about people by their teeth too. So like, I kind of want you can see a big window into someone just by their smile. You know, like you know, because we don't want to judge people, but we're human beings and we immediately do so. And one of the giveaways is their mouth. Like, it's hygiene you can see, you know, like, so if you see someone with poor oral hygiene, you're like, okay, what's the rest of the hygiene? Like, you know, you know, if it's a demonstration of your compliance to regular health care, right? You know, and the basics of prevention. So if you see someone with, like, imperfect oral presentation, and say if it's a job interview, and I'm like, if I can see that you can't even look after yourself, right, in the basic way, then how are you going to look after my business, right? And we don't consciously think that, but we do, right?
Yes.
There's a lot of other studies, like, too, like, statistically, the nicer your teeth, the more money you earn. The difference between socioeconomic status is 6 teeth missing. Bullying is a big one.
Teeth.
Yeah, bullying teeth, like, no, like anything, like missing teeth, like, you know, just general anesthetic smile. What else? Like, symmetry of the face. Like, so if you have a symmetrical face, you'll deemed as more trustworthy. And there's, like, a lot of social sciences to prove that. The more symmetrical face, the more attractive you're deemed. The more attractive you are, the less likely you are to be punished for things in the eyes of the law. The more attractive your features of your face, the more attention you'll get at school. So therefore, potentially you're a better student because your teachers will give you more attention. So, like, there's a lot of, like, little things, like, it's the minutia of such a small area, but they can impact a lot of things. Potentially your future life.
I think if people heard this stuff, they'll be more inclined to floss and brush their teeth, because it's like, it's not just like not having shitty teeth, it's all these other things. And
people aren't aware of that. Like, I think they are. Like, and you know, I've had people cry in front of me, like, saying, like, that, you know, they don't like to smile, and it's heartbreaking, because, like, you can fix this, you know, like, and that's, again, sometimes it comes down to the money thing too, and I always think sometimes the money thing spoils the dentistry, because I can do so much, but it has to be within someone's affordability sometimes, and you know, it does really come down to that at times, and people put in the too hard basket, but that's why I'm very big on kids dentistry too, because if you can teach a kid
good oral hygiene,
not even a diet, everything, the biggest thing for it is diet. Like, you know, like with exercise, like, we know really well that you cannot out exercise a bad diet, right? You cannot out hygiene a bad diet. So, like, if your consumption of highly fermentable carbohydrates is very frequent, you're not going to win that. You know, like, you can brush and floss as much as you like, you're going to lose. So if a kid is taught early, I would say to him, I don't want you to be perfect. I don't care about you being perfect. I'm not perfect. But I want you to be reasonable. And I need to teach you what that means, because people's version of reasonable is sometimes very unreasonable, you know. So if a kid learns that, like, I always say, like, I've never had a filling. I've never had any dentistry on me. you know, like fortunate enough to have a dad as a dentist. So, you know, I was taught early, you know, and all this stuff I'm doing to other people, I don't know. You know, like I don't know what that's like, you know. And if I can get every kid to be like me, then I win. You know, it's not the most profitable way to be a dentist. You know, we get paid to do stuff, but it's more rewarding when
it's prevention based.
Yeah, or you see a kid with like a few holes in their baby teeth, and then you fix the teeth, and you fix the family lifestyle at home, and they become a teenager and they're perfect. And you're like, you know, if you didn't intervene as like a 4, 5, 6 year old, that kid is a different teenager, you know. So
yeah, so that was actually one of the questions I was going to ask, because I think generally most people would know you should brush your teeth twice a day and you should floss every day. Besides that, as the baseline, you've already kind of touched on it, like, you know, refined sugars and fermented carbohydrates. What are some things I guess the average person wouldn't consider when it comes to dental health? Because the other thing is, teeth, once it's gone, right? I think that's what people don't realize. You can't have it back, right? Yeah,
you can't, like with health, and you know this, like you can't, like once the level of derangement or injury or loss is there, no matter how much money you have, you cannot buy it back, right? So you have to prevent it at all costs, right? So musculoskeletal injury or anything like that, like once you have chronic problems, it's there. Like you're not fixing it at that point. You're managing it, right? So if you never get there, that's the name of the game. So so obviously one thing that people have a misunderstanding of with sugar is it's not how much sugar we consume that's the problem. It's the frequency, right? So if you went to the cinema, right, or post-comp, you know, like, you know, that big meal with all the treats, right? I don't care about that. That's not gonna affect your teeth at all. But if you are in an office job and you have a very small block of chocolate, and periodically through the day, break off a little square, paired with like a cup of tea or a biscuit, you know, which is really common, you know, especially like, you know, definitely. A lot of offices have like a bucket of biscuits. So they'll just go, you know, several times a day. That is a disaster, right? That is going to cook you. Whereas if you just ate the whole jar of cookies, whatever, it's not good for your waistline, but for your teeth, it will destroy your teeth. So frequency is the killer.
Why is that?
Because there's, if you want to go technical, there's something called the Stephan's curve. So every time we eat, so the carbohydrates feed the bacteria produces the acids, right, that eat the teeth essentially. But the defense of that is our saliva. So that buffers the acid. So what ends up happening is every repeated exposure of sugar through the day, the buffering time takes longer. So, you know, it might take like a very small amount on that first exposure to get your mouth back to neutral. Every time you do it through the day, it takes longer and longer. So you spend more of the time in an acidic environment, eating away at your teeth.
Yeah, that's really interesting, because in like physio, there's a similar concept. Like if someone has shoulder pain and they continue to, let's say, bench and push through the pain, then it's going to take longer and longer for that pain to go away. As opposed to if you had pain and you went to a physio the next day, we could get rid of it way faster.
Yeah, absolutely.
There's a cumulative effect.
Correct. Yeah, and it's small exposure, right? That will do the damage, right? So same with the sugar thing. So large exposure, no problem. Right? You can recover from that. But small repetitive trauma, slouching at your desk, you know, like all those little things like build up, and then, you know, like catastrophe, and then so that's what happens. So that's the fundamental.
The main one, you say, like just
fundamental. Well, it doesn't even have to be sugars, right? Well, sugars, like people also are not considering what sugar means too. So like sometimes with some kids we run into problems with, some kids are really picky eaters, and all they eat is fruit, right? Like fructose is a sugar. So if all you're eating is fruit and it's like 10, 12, 15, 20 times a day, right? That's the frequency. Even though fruit is good for you, but it's still a sugar. I run into this problem. Some people say, oh, but I only have agave syrup. It's natural. or I only have honey. It's natural. Well, yeah, it's true, and it's a probably better source of nutrition. But the body is not that smart. Like it's like it just sees what it gives you give it, right? So it doesn't care where it comes from. It could come from a packet or from a tree. Like it doesn't. All it sees is sugar.
Okay, so processed or not processed doesn't matter.
Doesn't matter.
Oh,
Doesn't
geez.
matter.
Okay.
Yeah. So that's why you have to be wary of like sometimes think people consider like chocolate lollies, like, but they're not considering
Like rice.
yeah, rice to some degree, yeah, but like you think like how much fermentable carbohydrate is in it? It's very small.
What do you mean by fermentable?
Like, the sugar component of rice,
Okay.
it's very, very small.
Okay.
But say something like, how would you say, cereal?
Oh, that would be pretty bad.
Yeah, right.
Yeah.
But you got to think it's just the cumulative damage for the day, right? So some people will like start the day with a coffee, right? They might put a teaspoon of sugar in it, right? Mm-hmm. So that's one exposure. Mm-hmm. Then they might like typical person is like not having the best breakfast. So, there might be, I don't know, some oats with some honey in it. Then that's second exposure. Then they might have a snack, piece of fruit. That's 3. Then they might have their lunch with a snack, like with a treat at the end.
With
That's
Coke.
4. Yeah, or like fruit juice. That's the big one. Fruit juices.
Fruit juice?
Yeah, fruit juice is the enemy. Like,
That's interesting.
yeah, anyone that consumes fruit juice, because like if you think about it, like say an orange, right? If you had to eat an orange, you might eat 1, maybe 2, right? If it was a great orange. Right, but you couldn't consistently eat oranges through the day because you just wouldn't. Like you'd get palate fatigue. You just wouldn't do it, right? But you can drink orange juice through the day easily.
Yeah.
Easily, you could easily do that, right? Like it's not going to kill you, like to have to have a glass here or there, but yeah, people that drink fruit juice, yeah.
I would say that's mostly kids. Even
Kids,
worse.
yeah, that's right. But then there's even things like people that drink a lot of milk is like like lactose is a sugar, right? So like anything oats, right? You got to be wary of, right? Okay. So like even people like that drink a lot of milk frequency is a problem. Like
that's crazy. This goes really deep then.
Yeah, it's like the cumulative like nature of what people do during the day, and it's like people are so unaware of until like you start breaking it down, and then you kind of like so for us, like in like athletes, and like I've actually done studies on this, like showing athletes have worse teeth than general population too because of our eating frequency. So we do have to be mindful of what our meals look like, and my kind of biggest enemy is fruit for me, right? So three of my meals a day has fruit in it. So,
What do you do as a, I guess, precaution?
Well, the thing is I'm not snacking, right? So, I'm outside of those 5 meals. It's really that's it. I'm not having anything else. So like
biscuits or chocolates and stuff.
Yeah, I'm not because it just ruins my appetite.
Yeah.
When you got to eat a lot of food, like the idea of like having a snack is awful. Because it just slows down your biggest worry at the end of the day is you're not going to eat enough. So yeah, that's one way. But then like you see guys at the high, say like using bodybuilding as an example, but any endurance, really high level endurance, when they're consuming a lot of carbohydrates, it ends up being honey, jam, like you see it, like see guys like, and they almost, they glorify it, like, and I'm just thinking, shit, man, like it's like, the amount of guys have like extracted teeth mid-prep on them, getting tooth infections and root canal treatments and, a lot of like the pro athletes that come to see me, like when they're supposed to be at their peak performance is when their mouth is the worst. That's really not helping performance,
Yeah.
And then like even when it comes down to things like gum health, like like there's like this is not like it's known, right? So we know that like any poor oral health results in poor glucose metabolism. So most notably seen in diabetics, where it's like it's very like clear, like when you fix the oral health the requirement for insulin on blood sugar control like is much improved. But at the athletic level, if we're not like metabolizing carbohydrates properly, like our performance is now interfered with, our recovery is now interfered with, you know. So that's just from the nutrition point of view, like how our mouth can affect that.
Would you say like the diet's actually the most important thing? Is
Absolutely. Absolutely.
Okay.
But then there's other things like, you know, like there's
what
things
other
that
small things you would say?
there's other things. So like, you know, I guess like nutrition for tooth holes, like, and then like obviously hygiene to prevent gum issues. But we see a lot of things like, particularly in the big guys, like the body doesn't care if it's muscle or fat. Being big isn't great for you. You know,
Yes.
We know that, right? So with that comes sleep apnea issues. So when I look into some of these big guys' mouths, so there might be fat guys or
Bodybuilders.
Big large bodybuilders.
Yeah.
Their airway is like the size of a small child, you know, and they're a huge human, you know, and then like their airway is like teeny weeny because there's so much compression around the neck. So if it's fat, you know, that's obvious.
Yeah.
But the muscular tension created around the neck results in a lot of sleep apnea issues. So you'll see that by tooth grinding. You'll see like a lot of tooth wear. You'll see like, you know, like even like their breathing patterns are changed even when they're awake. So you see like
Mouth
if that's what you
breathers.
look like when you're awake, imagine what that's looking like when you're asleep.
It's probably even worse.
Yeah, no, it's not. Probably it is 100% like magnitudes worse, like to the point where you could die. You know, so and then again, that comes down to performance too. Like if you're that airway constricted, like, you know, and that's fixable, you know, you need to address that because then, you know, from one, just a general health point of view, but two, even performance.
You're not going to recover.
Not going to recover, but even in the gym itself, you know, like, you know, airway patency, you know, we need to get that in. So, so if there's ways of addressing that, sometimes there's not. Sometimes it's just structural and they just need to lose weight. But sometimes it's like surgical intervention will really help and open up those airways. So,
Yeah.
sometimes it's just a matter of just losing weight, which
Yeah.
I'm a prime example of that. When in prep, when my body weight's low, I have no sleep apnea. Right. As soon as, literally a few days after, as soon as I start eating again, straight away, sleep apnea back.
How do you know did you do a sleep study?
Yeah. Well, so like initially, it's snoring, right?
Yeah. Okay. Yeah.
But you know, like, you
Just
know,
feel-
like
just waking up feeling
if you're not sleeping with someone, you don't know.
Yeah.
Right. Fortunately enough, I have like someone that's like next to me that's getting annoyed by this, right? So, but initially I wasn't that concerned. I was like, that's your problem, not my problem. Like, but then if you're routinely surveying your health, you know, that's when you start seeing problems. So one thing is, because I'm checking my blood pressure once a week, I started seeing a slow increase in blood pressure, right? It's still in normal range, but trending badly, right? Trending in the wrong direction, right? Despite cardiovascular fitness, doing cardio, staying on top of your diet, blah, blah, right? You know, so that wasn't good. And then, even then I wasn't that concerned because, like, you know, still normal range, so
Yeah.
whatever. But then I started seeing it in my blood work, right? So then my hematocrit started climbing and climbing and climbing, despite whatever interventions you want to do. Like, you know, you want to do blood donation.
Yeah.
You want to
Really
take ARBs.
Yeah,
you want to blah, blah, do whatever. That's a sign there's something wrong there, right? So then obviously you kind of know you have sleep apnea, right? And you don't even realize how bad you feel because you're like that
That's
every day.
default. Yeah.
That's your normal. Like, you know, if you have chronic back pain, you don't even know what it's like to not have back
Yes.
pain. So if your default position is not good, you don't even know.
Yeah.
And then, you know, so, you know, like once I started, so even that isn't a warning enough, like feeling tired, because like you just blame it on something. I'm training too hard, I'm working too much, not sleeping enough, like your nutrition is not maybe off or something, like you'll make whatever reason. But when you start seeing it in your
blood work,
it's quantifiably, like blood pressure going up, the numbers are not looking good. You have to really ask yourself, do you want to head down this track? Because that's certain death, and the amount of people are not checking, so they don't know, so they don't see the numbers. They don't understand how bad they feel, because that's what they feel like every day.
Yeah.
And then when I see them in the dental clinic and I tell them and I ask them the questions, and they're like always yes. I'm like, okay, you need to get a sleep study, right? And that alone is information. It'll tell you you have sleep apnea, but it's will only tell you yes or no, and if you do have it, mild, moderate, severe. But that's not. Then you have to address why, because like that's just an observable issue. That's the condition. But why do you have that condition? So that's when you have to go and see an ENT surgeon and see if it's a structural thing. Like, do you have blockage in your nose, large adenoids, tonsils, any airway obstructions? If that's fixable by surgery, great. And then surgery, then you're done. Sometimes it's not. Sometimes it's just you're too fat or too heavy.
I think that's easier. That should be easier to fix, because you just got to start. Surgery is very invasive.
Yeah, but like some people, it's a structural thing. Yeah, you're right. So it's fixable, right? But if it's like, and that will fix you, right? But if it's a weight thing, depends. Like if you're obese or overweight, yeah, you got to lose weight. But for us, what are we trying to do?
Get bigger.
Yeah. So that's not a solution for us. So
I think a lot of bodybuilders, they just use CPAPs these days.
We have to. But a lot is a rarity.
For sure.
They're not doing that.
The health conscious ones.
They're not doing that. Like, and I honestly believe that like this like sudden rise on heart attacks and cardiovascular events that are happening in bodybuilders is directly because of the sleep apnea. Because the guys are just getting bigger and bigger and bigger. And then people are blaming XYZ, but I don't think people are thinking about sleep apnea here. I really honestly think that that's the cause, and people are blaming the drugs. Like, the drugs are the cause for sure, because they work. They do what they're supposed to do. What do they do? Make you bigger, right? And being big is what's going to kill you. Like, it's not the drugs, right? People want to take it. It's not. The drugs it's a tool, and because they're doing its job, you got a problem. Yeah.
So you said one of the things that you can, as a symptom, is teeth grinding. So the last time I went to the dentist, she actually said, I've been wearing my enamel down, and now I'm wearing like this mouth guard at night to prevent that. What do you think is the main cause of this? She said it was maybe stress, but I don't really feel stress.
Yeah, there's some people that have that element, but like, do you snore at all?
I don't know.
You don't know? I
tape my mouth to sleep.
Yeah, so like the mouth taping thing, this is like a contentious thing. Like, I really don't like it, right? Because like
I sleep better since I've done it.
Yeah, but like, why are you sleeping with your mouth open? Like, you're not doing it on purpose. You're doing it for a reason. So if your body feels like it needs to get more oxygen by using your mouth being open, there's a reason why, right?
Maybe there's airway blockage.
Could be. Like, it's not always, like, it could be allergies. It could just be sleep hygiene. It could be like inflammatory foods, or like, there's like a lot of things. That's why I say sleep apnea is one thing. But like, why do you have it? Like, is it allergy? Is it structural? Is it, like, is it food intolerance? Is it like, you need to work.
Okay, so there's still like a root.
Yeah, like CPAP is one thing. Like, like that'll fix all problems, right?
Yeah.
But it's not the treatment. The treatment could be like, getting allergy tests and working out what things are. Like, how well are you breathing through your nose? Like, all these things. So if you're grinding your teeth at night, a lot of time it is to do with, some sort of airway obstruction. Yeah, it could be stress too. And once we have that default pattern, like that neuromuscular kind of repetitive muscle memory, a lot of time in our sleep, like that's when we kind of
people do that the most.
People think that like that's our reparative period of our sleep, right? But then also that's the time when the hippocampus reviews everything we've done in the day. So if it's been a particularly stressful day, what do you think? It's going to manifest in your mouth, right? And the other thing is like things like jaw pain, or even muscle tension around the face, headaches,
TMJ.
Like the trigeminal nerve is one of the cranial nerves that goes directly to your mouth, and like anything influenced here is a very short direction straight to our brain. So a lot of time like solving those problems can like alleviate headaches and tension headaches, and migraines, and
She said it was really common now. Like she gets Botox like every so often, but it seems like it's a pandemic of teeth grinders.
Stress, yeah, but like also like I really suspect a lot of people do have like very mild sleep apnea that they need to check and address. Especially in larger guys for sure. Something that I'd consider doing. But yeah, you're doing the preventative stuff like wearing the occlusal splint to sleep, which is very helpful. Yeah, and then it would be like a matter of like like I grind my teeth too. I wear a occlusal splint too, so it's like I'm a very attractive guy to sleep next to occlusal splint.
It's alright. I'm already mouth taped.
Taped to a machine. Yeah. Like oh yeah, it's great. Grown up stuff.
I got this. This was a question from not a guest. Sorry, like this is a question from someone because I asked questions to like my Instagram followers and like they asked. Has anyone ever bit you and did you like it?
Did I like it? Well, coming from being a vet, right, where you get bitten all the time, and I have like scars all over my hands and in parts of my body to show like how many times I've been bitten. That's very common there, right? Thankfully, most people don't, right?
Okay.
I have. It's usually kids that will do it by accident, but and do I like it? Absolutely not, because like. Even when my kids like roughhouse play a little bit, like, and they might like be like being a bit rough in my hands, that's a problem, because unfortunately my hands are
your career.
Yeah. So I'm very conscious about that, and even with the physio thing, like there was one stage where, so one of the earliest forms of retirement for a dentist is musculoskeletal issues. So, for us as our job is our occupational hazard. So just sitting all day long.
Bent over.
Well, you're not supposed to be bent over, but like a lot of time we're sitting like this, right? But the neck position is like kind of forward head position.
Yeah.
So you can mitigate that by wearing loops with a down angle to stop you from tilting your head.
Yeah.
So I wear those. But then the other one is the rotation, because I'm left-handed. I'll sit with a slight rotation. So then that affects shoulder position. So all these things so if you're not actively looking after your body as a dentist, like it's the most common cause of early retirement is neck or back pain. So, but I've had instances where, because of those issues, I haven't been like, I remember one time I couldn't even close a fist because my elbow was hurting so much. My wrist was hurting so much, and I didn't understand actually. I thought it was I was like, I haven't hurt myself in the gym. Like, where is this coming from? Like, it got to the point where I was like, to extract the tooth. Like, I'm a strong guy. Like, I couldn't tension anything. And then, thankfully, I have pretty good physio. It's actually it was coming from my neck, right? That neural derangement it wasn't a muscle pain. It was a nerve issue. So pretty interesting that.
It's funny because I saw a GP with the same issue, like because computer's there and she just treat patients like that, and it's like that just constant tension of never turning the other way. Just messed her up.
So your hands are your life, like for us, So did I like it when I get bitten? No, but does it happen? It's not that common.
Cool. All right, we're gonna pivot more so to bodybuilding and competing, because that's also a big aspect of your life, and that's actually how I met you.
Yeah.
So
it was cool, like meeting like a few like health professionals that compete too, right? So there's not that many of us. So.
There's only. Do you know Paul Zidis or something? He's actually the bodybuilding.
Paul Zidis, I used to train at the gym with him. Paddle Performance.
Paddle Performance.
Yeah. We used to train at my gym together.
So besides him, Jules, and me, I think we're the only physios that bodybuild. So it's, and I think you're the only dentist.
There's a couple of chiros.
Yeah, there's chiros.
There's actually a really famous dentist that's like he's an IFBB pro. His name's
really?
Thomas Conley. He's like he did Post Malone's teeth. He does like he did Shaq's teeth. Like so.
Okay.
He's classic physique pro.
American?
Yeah,
Okay.
yeah. Like Post Malone's teeth is probably his most famous one.
Yeah, okay.
He had $1.6 million of dental rehab. $1.6 million.
But I think
And
Post Malone's
people
diet's
complain
not
when I tell them they need a root canal treatment for $1,400.
Yeah.
Post Malone spent 1.6 million.
Yeah.
Like, don't complain.
Yeah.
Yeah. So that guy, he's doing all those guys. So, and he's pretty jacked.
But yeah, how did you get into this competing thing? Like, I know you told me like off camera, you started powerlifting. Was that your main sport when you were growing up?
Well, funny enough, I used to play a lot of sports as a kid. Used to race motocross, play a lot of tennis, endurance running. Very skinny kid. I was only 57 kilos. Played a lot of music as well, a lot of musical instruments.
What instruments?
So piano primarily, then the drums, the flute, all the saxophones.
I play the drums too.
Yeah, I know, but you're much better than I. I'm a terrible drummer. I'm a terrible drummer. Like actually, the funny thing is like, I really wanted to play the drums, right? And my dad thought like I wouldn't play the drums if he forced me to play the flute. He said, if you're going to play the drums, you have to play the flute too. Turns out I'm good at the flute, terrible at the drums. So like, yeah, the drums, like I still like to play, but I'm just not, it's just a timing thing. I can't stay with it. Like I race forward, I come back. I can do it. I can do it, but like I'm not consistent. Like I just that's a special, like to live like a metronome. Yeah. Like I just that's in you. Like you know like that. And like jazz is cool because you can play off the beat a little bit. And like that's like jazz pianos too. Like jazz is cool because it's not strict. But that's not real life.
That's
real
not
life
most music.
Yeah, you're playing in a band. You're playing, I had to take my studies more seriously because I was going to be a dentist, remember? So that involved a lot of study now, and I was always very, very good at school, but I need to be not good. I need to be the best, right? So that meant, making sacrifices. No more sport, no more music. And I shit you not when I say this, like that was the most traumatic studying of my life in high school. I would study 6 hours a day on a weeknight and 10 hours a day on a weekend, because I knew I wasn't a very good student, so it required just effort. I need to effort my way there, not intelligence my way there. So if I'm studying now 6 hours a day, which in the past would have been like taken up by music or sport, I did that for a while, and I was like going to go crazy. I was like sitting in my room. I was like, I can't sit here. So I said to my dad, like, I can't do this. I can't just sit in my room all day. He's like, why don't you go to the gym? I was like, what's that? He's like, I'll take you, I'll show you. And my dad's not good at the gym. But he took me there, and he's like, okay, there's your gym membership. And then I kind of left. And I was like, okay. So I had to like kind of learn what to do. And I really enjoyed like the learning how to train. And then I started seeing some results. So like, funny enough, I went from 57 kilos to 82 kilos in 1 year.
Wow.
Right? Eating everything wrong. Yeah. Training everything wrong. Newbie gains. You know, like. Yeah. But phenomenal progress, right? Yeah. I went from like the skinny kid to the most jacked kid. Yeah. Very quickly. Like, so.
Persian genetics.
Oh, I don't know. I don't know what it is. I think probably because of the endurance activities. Like I was probably like kind of under eating my whole life, and then all of a sudden I started training. My appetite went up, and maybe I was supposed to be like that initially already. So I think maybe I was just growing into my normal self. Who knows, really? But I enjoyed the training. I enjoyed the eating. And then I enjoyed the sciencing of it as well, because I'm a science guy, and the learning about the minutiae. And like, it's quite funny because like when you only had the bodybuilding magazines and you didn't have like a lot to go by, the learning was tough, you know, and there was like a lot of myths out there. And but yeah, I ended up training and making a lot of progress, and I never intended on being a bodybuilder. In actual fact, it was a problem at one stage of training because, like, believe it or not, my job was a full-time model when I was a kid, and they didn't like me being big.
Too big.
Yeah, like, so like I liked being in the gym, so like, but they didn't want me muscular, so I had to keep on. I was consistently dieting, and it was annoying, you know, and I had to be small all the time, and at some stage I started starting to get a bit frustrated with it, so I just kept on, even though I was getting in trouble by my agents, like, you know, and then I was starting to get less and less work over time, but I enjoyed the training so much and the eating, and then it was got to the point where I was went from like high fashion to streetwear, then to underwear only, and then
fitness modeling, and
then no, I never did fitness modeling really. It was like here and there, but like it was mainly like, you know, like it started becoming underwear in the end, and then I was just like, I just need to enjoy training, and then so then I started in powerlifting after that, once I started like taking off the brakes, and then so like the guys from Biologic in Brisbane are pretty famous guys for this power building style, like Tim McKinnon started there, like a few good guys came out of that place, Damon Hayhow, this power bodybuilding style, like, you know, it was really fun, like lifting really heavy, and like powerlifting is really fun, but then even though I started getting really strong, the injuries started happening, so that's was a bit of a deterrent in the end. So then I was like, okay, look, no more powerlifting, let's start training for enjoyment, like bodybuilding style. And then I got to a certain size, and then people started bugging me saying like, oh, you should compete. You should compete. And I was like, why would you want to do that? Like, you know,
diet for 16 weeks.
No, not even that. I had no idea that was even a thing. I was just like to stand in your undies, shaved all your hair, painted yourself in tan. Like, it's not like that I was unaccustomed to standing in front of people with no clothes on, because like I was doing the underwear modeling, and like, you know, like the runway for that is like a lot of people in the room, but they're not like, they're actually looking at the underwear. They're not overly critiquing your physique and stuff. So that was a bit of a
deterrence.
Not deterrence, but I just found it very strange to do. Anyway, I gave in, and my coach, who wasn't my coach at the time, was a good friend of mine, Chris Thomas, Alpha Ethos. He is like, let's do a show. I'll prep with you. We're gonna. So John Davies was my first coach. He's the guy that owns all the world gyms.
Oh, cool.
So he was my first coach, and he kind of showed me how to diet, what it was like to get into contest shape, end up winning my first show, so that was pretty great. And then I was like, oh, you're kind of good at this, you know? So I started down that track, but then I lost interest in it because I kind of became aware of what it took to become a professional. Like, it wasn't good. Like, I'm not great at doing things half. Like, I have to do things to the nth degree, and like I saw what you had to do to become a professional. So I was like, just the size requirement alone, I wasn't that comfortable with getting that big. It would have been nice, but yeah, like being the health-minded person, I wasn't overly happy. And then also the aesthetic of it at the time. So my favorite bodybuilders when I was a kid was Frank Zane, Bob Paris, Lee Labrada, like the smaller guys, really shapely, really shredded, like, and then like, you know, at the time when I was competing in my early 20s, Mr. Olympia at the time was Ronnie Coleman, you know, like, and like, you know, that you started seeing the turtle guts and
freaks.
Yeah, the big waists, and like that wasn't appealing to me, you know. That's not what bodybuilding in my mind. That's not the way I wanted to look. So then I still trained, but I started getting more focused on, you know, my studies and my career, and that stuff started happening, and so it was always in the background. But then Men's Physique came. Like, I was like, okay, what's this? Because initially it was only men's bodybuilding, female bodybuilding, and figure. That's it. You go to show. It's very simple. It was great. Like, you know, now shows, like, they go so long because now there's all these new divisions, and it's kind of horrible actually. But especially for us,
because we experienced it.
We're always right at the end. No one cares about us. Men's Physique came out. I was like, what is this? Wearing board shorts. They didn't even look like they trained. And like, I, you know, came from bodybuilding, and I was like, you know, like I knew what to get into true contest shape was. Like, they didn't look like they dieted. And I was like, that guy won Mr. Olympia in doing this. I was like, this is garbage, you know. And then, so I wasn't interested in that. But then Classic came out, and then coincidentally at the same time, the evolution of men's physique, the guys were getting bigger and they started kind of looking like bodybuilders now, you know. So I was like, okay, you know, starting to get a bit more appealing. But in my mind, like I was an open class bodybuilder. I was like, I'm not gonna freaking wear bot shorts. This is,
it's beneath you.
I was like, yeah, what is this? Like I train legs hard, you know. I like training legs, you know, I enjoy it. Arguably, like my legs are like, they're not the biggest, but like they're
pretty
conditioned,
strong,
conditioned, like the shape. So like to not show my legs, like is like almost like it felt like like harming me. You know? So in 2019, I decided to have a good crack at it again. So I did the Arnold Classic there. Wanted to be a classic guy, not realizing how big the guys were getting, and came third in novice, and that was soul crushing to me because I'd never not won. So that was at the stage show, and that was a bad experience for that to happen. I was like, I'm not used to
losing.
Yeah, like people, third place is good. I'm like, third place in the state. I'm like, it's garbage.
Yeah.
You know, especially in my family, you don't come third. That's like you're disgusted. And then so last minute, I decided I'll do Classic, but let me give men's physique a go. So I had no idea what to do. Called Amy Fox. She ran me through some poses like the day before.
Was this the show you bought
2019
board shorts?
Yeah,
Let me tell
I went and bought board shorts from Best and Less for $2. Right, literally $2. I was like not going to invest any effort into that, and then end up winning the Arnold Classic. so like in men's physique. So I was like, but that year LaQuinton turned pro, and then I was like, maybe I can do this. Like like maybe turning pro is an option. I never considered becoming a pro bodybuilder ever. Like that was like not really a thing. Like I love training. I like competing more for like the process of competing, not like, I obviously like to win too. Like you don't go there to lose. Like no one does, right? Yeah. But the true mastery of your emotions and the desire to do primal things like eat, when you're hungry and to train when you're tired. Like I love that. Like what you said in the gym today, like, like that we're looking for the pain. It's like a bit sadist masochistic. Like, like we're looking for like
how hard torture. Can we make it?
Yeah. I like that about competing because it's hard to do. And it's a demonstration, not to myself, not so much to other people, but to know I have mastery of myself. And that feels good because I see like a lot of people in life that they're not in control, and it's a way of like proving to myself from time to time that I am in control. I can do whatever I say I can do, I will do it, and that's nice to be able to kind of quantify that because it's difficult to quantify. You can say you're just being strict or something, but to really get to that level where it's straight up torture. And I think we were talking about this before. It's like your physique is something that you display to the outside world, and that's something that I wear with a badge of honor because it's not like, especially like you especially when you grow up around really privileged people and when you come from an immigrant family, like, and you see like what people have and don't have, and you see like things can be bought, things can be given to you, right? Genetics, sometimes you just get lucky, but in the genetic lottery, but your physique is work, no matter what the circumstances is. You have advantages when you have money and genetics and maybe a supplement sponsor that gives you things, right? Whatever things can be, but you still have to work, and that display of work is shown on you, and you can walk through life displaying that, so it's a demonstration of willpower, effort, consistency. I think that's nice, knowing that we can do that.
When you were saying the thing about like dental health being like you're more likely to get hired and whatnot, I think of physique is that too. Like if you have two like applicants and one is like in shape and one's not, you can kind of already deduce that this guy probably can do some hard work. This guy can.
To some degree, I'd like to say that's true, but also it's also a demonstration of like a funny conversation with some kids at the gym. Like there's some young guys there's about 4 of them. They were crowded around me at the gym. Like I was in pretty good shape at the time. They're like, oh, the girls must love it. Like I'm like, do you see any girls around here right now? This is four of you dudes. I'm like, this is not like, I was like, muscles are like mustaches. Only other dudes respect it, right? So like sometimes that display is sometimes off-putting to some people because it's like, it does show a little bit of preoccupation. It does show about a bit of self-focus. So I think like really like, if you really look at like evolutionary like data, it's like through the dawn of time, the ideal man has always been the kind of like that Spartan swimmer, like that kind of physique. Like once you get beyond that,
sure, yeah.
It shows a peculiarity of your personality, right? So that obsessive. Might get you the job, might not, right? Because like that obsessiveness
can be good or bad.
Yeah. So in some ways, people will be attracted to that. In some ways, some people will be deterred by that.
Sure.
For whatever reason, they might have to be deterred, either like mirroring their own self-inadequacy, or from a negative point of view, even from a positive point of view, this guy is just like, he's just going to be annoying to be around because he's just going to talk about the gym all the time. Something like that. I just want to see this guy eating all this food all over. So it might not be like personal judgment. It'd just be like, I know what's required of that.
But this is a side tangent, but we were talking about this off camera too. It's like, I think what's interesting about you is like, even though the gym is a very big aspect of your life, it's also, you're not a meathead. You're like, we can have conversations about like how like anything, literature, health literature, like random stuff that's not to do with like the gym either,
or even science at all. Like I love everything. I'm just interested in stuff. Like I always say, I'm not good at anything, but I'm very interested in things. Like so, if I'm interested in it, I'm gonna learn everything about it. So I'm a nerd. Like that's who I am. I'm not a meathead. It's just like being a meathead came as a byproduct of me being a nerd, right? Because I wanted to know, how do you grow muscles? What do you need to eat? How do you need to train? Like what does the literature say about like training? What does literature say about food? What's bullshit? What's not bullshit? Because you get, oh man, like I probably could have like another down payment for a house and the amount of money I've spent on supplements in dumb supplement stores that don't do nothing. This is the bullshit of the fitness industry, and you just wish people knew. That like they get sold on these quick fixes and drink this and eat that and don't eat this, and it's all nonsense.
There's a lot of BS out there, but
we had to learn that, right?
I think fortunately for me, I had the internet at least. You didn't have it. But no, I'm just saying more so like you have a very multifaceted personality to you, which is not just like gym, which is very common, right, in our space. Especially at the highest level, like now, like the guys you're competing against aren't, they're coaches, they're full-time coaches, full-time competitors, pro bodybuilders, like that's their job. So I like to think, like I love being in prep for a contest because it does enhance the other areas of my life. Like my scheduling gets better because I know I'm not, like on a normal week, like we're pretty strict, but like if you're really, really tired one day, you don't have to go. You don't have to go to the gym. You might take an extra day off. But in prep, that's not negotiable. Like it doesn't matter if you're tired. You gotta go. It doesn't matter if you're hungry. You gotta not eat. So like to stop myself obsessing over food, I work more.
you know, so that's been very helpful for me, like, you know, to put my energy into my work and into other people, you know, like, and it's not like and it took me a while to learn that, actually, like, because initially I wouldn't do that. I'd kind of withdraw, go into my own show, and like, I'm in prep now, don't bother me, like, you know, like, so I do the opposite now, you know, bother me. You know? Like, I don't want to be I want to do things, I want to go out, I want to be with people, because I'm not focusing on myself, because then, like, the byproduct is that you just start staring at the mirror all the time, and I don't think that's healthy either, mentally, so so that made me better at my job, like, you know, and then that extra bit of discipline means, like, your scheduling's better, and byproduct is that you earn more money.
Yes.
You know, you're a better demonstration of health to your community, so that indirectly aids you. Bar the last couple of weeks of prep, and then you become pretty useless at that point. At that point, you're just trying to get through the day. You
feel like the wind can blow you away.
Like, it's but even more so in that situation, again, even more, I try and channel the work. I try and channel other people. I try and, you know, like, because if you get stuck in that headspace, you're going to crack. You're going to see that McDonald's sign and go to that drive-through, or you're going to, like, you know, I prepare the meals for my family as well, and like, and I'm making their food, and I'm like eating this, like, you know, like this little amount of food, and you know, if you're not focused, you'll cheat on your diet. You do something.
On that topic, because how many preps have you done?
So at the start, like, so what did I do? I did 2 shows, early 20s, then realized that was not going to be my future. Then 2019, and then I was like, okay, you can turn pro, right? So I was like, okay, now that was like, I was really out of shape when I did that prep, and, you know, like, I was not like who I am now. Like, I was not like, or who I was, because I was focused on other things. I was like, that's how well you did with like a crappy start position. I was like, what happens if you do everything right? So I set a plan. I said, okay, look, that was season A, 2019, the last Arnold Classic, unfortunately. That was the last ever one. And then I said, okay, I'll do season B the following year, right? So give myself an off season, but I'm going to do everything right. And I did that, right? I made phenomenal progress, right? And then I dieted, and then
COVID.
Yeah. So that, like, 7 weeks out, cancelled. So I was like, oh, damn it. Like, you know, all this work. Okay, look, it's still on the path. I want to turn pro. Like, you know, like, that was, you know, I'm going for this, right? And then I was like, okay, following year, season B. Like, you know, because COVID was too unpredictable. I was like, okay, maybe by the following year, we'll have our shit together. So I put in the prep, and then cancelled again. So that's
the second one.
Yeah. So right. Geez. So that's like, now that was like 2 preps in a row that were like, had to be abandoned, not for any fault of my own, like just the circumstances at the time. And then I was like, okay, let's do season A. So I was like, because I was pretty close to being in shape. So I was like, if I don't get fat from here, like, let's roll in, like, let's just maintain this, like, let's not be an idiot over Christmas. Like, everyone likes to eat over Christmas. I was like, okay, like, and my coach at the time, he was like, I was like, oh, okay, so prep starts after Christmas, New Year, and he goes, no,
now
prep starts now, and I'm like, oh, so I don't even get to enjoy Christmas. No. So I got 1 day off for Christmas. That's it. That's all I was allowed. And then it was like full prep mode, and then I went to season A. That was probably my best showing. One classic, the state show, and then I didn't win the men's physique in the state show, funnily enough. There was a couple of reasons why. Bobby Randall, I'm gonna blame you for this. He was doing the backstage, and I kind of missed going up, and I ran up.
I was
because he was telling me, you've got time, because they told me there was gonna be I needed to go back onto stage as classic. So it's like pump. And I was like, I was exhausted by that stage. And it's like, oh, okay, no, you're not going back on stage. I was like, okay. So I was like, okay, I'll go put my board shorts on. And he's like, you got time, don't worry. Just like, rest a little bit. I'll call you. Did he call me? He didn't call me. So I ran on stage, yeah.
Yeah, I remember seeing, and because also your shorts were kind of short, so your quads were like bursting through your shorts, and everyone else had no quads.
Yeah. So I ran onto the stage and just joined the end of the line. So everyone had done their routines. Like I didn't do a routine. I just went straight into comparisons. Ended up coming third there, and Patrick was in that lineup. And Fabian's great. He's a great bodybuilder.
His midsection is crazy.
Yeah, Fabian is like a phenomenal bodybuilder. He looks really good now too. By the way, shout out to him. But then Patrick, like he was the guy with the muscle mass too. I'm a bigger guy. Like this is the first time I actually been one of the bigger guys. Like so, I was pretty happy with that because I was always the small guy beating the bigger guy. So now it's like okay, now I'm one of the bigger guys.
Back in opens, you mean?
Yeah. And then even in classic in 2019, I was like the small guy.
Right.
But now it's the first time I've gone into a show being the bigger guy. And then so Patrick was the other bigger guy, and he's phenomenal back on Patrick. It's like from the back, like
his back is crazy.
Yeah, and like that, my back is my strong point, and I'm like, like if he's outbacks me, then like I've got some effort to put in here.
Yeah, but this is my personal opinion. Out conditioned. I mean, you out conditioned him. In my opinion.
It's like this is remember we were talking about this is very opinionated based sport. So look, I'm not going to take away from him. Like, yeah, he beat me. The judges say so, but yeah, like you could have argued. So like we went into nationals. I didn't do well in classic that one. I came fourth, which but my whole time on my mind was set on the men's physique. So when I made it to the overall there, and it was just me and Patrick there, and had that experience again, having a pro card put in front of your face, and they say, "Would you like it?" Nope, it's Patrick's, right? So yeah, that was like tough, because you do everything you can to get there, but that's the way it goes, So then I was like, okay, look, like surely after like 2 good shows now, like where I've made it to the front of the line, like surely like I'm in line for a pro card like eventually, right? So I was like, okay, let's just go straight into another prep into season B. And I was pretty tired, like my body was a bit beaten up. I did a small pec tear before that prep, and then I picked up an elbow injury coming in. But look, you can say whatever you want, excuses. I grinded through the prep. I was bigger, leaner again, but yeah, just didn't play out again. So here we are.
Yeah. It's you've come this last year. You've come second so many times. Like you've always been like an inch away from.
Yeah, it's like even the gold medal. So the funny thing as well is in like early on in bodybuilding, they gave you really good trophies. Now they just give you this gold medal. Like, and I've got like a few of them now. Like, like a few of these gold, they don't even change. Like, they look exactly the same. And I don't know if you saw, they're in the garage. They're just sitting on the floor. Like, I don't care about them. Like, it's like, no, I don't. Like, all I want is the car.
Yeah.
I don't care about this thing. Like, like my kids play with them as frisbees. Like, I'm like, just whatever. Like, because you don't know which one this is from, which show. Like,
it doesn't even say that.
Doesn't even say. Doesn't say anything. Funny enough, the one from 2019, the Army Classic one, right? Yeah. They didn't even give me the 2019 one. They gave me the 2018 one in 2019. That's how terrible. Dodgy. That's how dodgy terrible. The IFBB is. Right. But I like the 2018 one. It looks nice.
It looks better.
It looks nicer, but that one at least had the year on it.
Yeah.
But this one, and it says Arnold Classic on it, which is cool. But this one. Yeah, like now they just look exactly the same every year, every show. Like it's like you don't even get.
It's not personalized. Which sucks.
No, at least now for the overall for the state show they gave that trophy. I remember that like the glass one.
I
It looked
wasn't
like
paying
a
attention.
pyramid, like, and then
Oh yeah,
and then the state show when
Yeah.
I won the class in state, and then went to overall with Tavisha, and I was like, I want that. Like, at least it's better,
Different.
better than this one.
Yeah.
And then Tavisha edged me out there.
Yeah.
So. Yeah, season B, that just didn't go to plan, even though it was better and bigger.
But then in that at States, you beat him.
Yeah, yeah. So yeah, it's like.
But it
That's,
still wasn't enough.
yeah, it's not about. It's like I don't even care. Like it gets to the point where like you just. There's only one.
It's only one
class.
spot.
Just, just pro cut. That's it. I don't know.
Yeah.
So yeah, I don't know what my plans are for coming up. Plan to improve the physique, make the improvements I need. Like, there's obviously, everyone knows, like, when they have like small things that they can improve. So obviously for me, my chest needs to come up. I'll bring up my arms a bit. Go towards more men's physique. I'll have to
More posing men's physique.
yeah, more men's physique posing, less focus on my legs. So, because we're wearing board shorts now, like, you know, like, gotta give up on the classic idea. Gotta like put it out of my mind. Like, yeah, you're not a classic guy, you're a men's physique guy. So yeah, that's gonna be the plan, and if we'll see. I don't know when the next show is, but when I feel I'm ready to like really, like, you know, I don't want to go in there like looking the same, you know, because I have to bring something different this time.
Yeah.
It's got to be special. Yeah, it's got to hurt more.
So I think this might be a good thing for the listeners to hear, which is like you've come so close so many times, and I think like that's more painful than like not even being like second is more painful than third, because second is just one spot away from first.
Yeah, I joke about it, like, and I've always been like this, and I didn't realize that I've even heard my kids say it, like, because I'm again, winning is everything in my family since I was small, and then I even heard my kids, like, they were arguing, and he goes, but I almost beat, one of my sons said to my other son, but I almost beat you, and then my older son said to the other son, he's like, yeah, but what's that? He goes, losing.
Wow.
Like almost, what's almost winning? Losing.
Yeah.
And then he's like, but I came second. Oh yeah, that's first loser, right? and even like we even joke about this one. It's like, what's like ones and twos in the toilet, right? What's two?
Poop.
Shit.
Yeah.
Do you want to be shit? Do you want to be shit? Don't be number two. You'd rather be third.
Yeah.
You'd rather be third because two is shit.
Yeah. So saying that a lot of people, they'll give up even when they lose once. So do you have any advice to someone who, a way for them to keep going? Because people lose motivation when they have the first hurdle or like one setback. Like why are you continuing to keep going after all these setbacks?
I'm not gonna lie, like the last one was the hardest one to take. Like that was difficult, like, because, you know, like I really in my mind I thought I was next in line, you know, like, but that's not, it's irrelevant. Like it's like you can flip a coin 10 times. If it's heads, doesn't mean that 11th time it's gonna be heads. You still have a 50% shot. Like, and as bad as it sounds, bodybuilding is like that. Like it's subjective, right?
Yes.
So as objective as you want, your prep can be, the numbers, the counting your macros, the being on your plan. You can be as precise as possible, and you're gonna do that to the nth degree. But at the end of the day, it's just an opinion. So you have to accept that.
Yeah.
Right. And that's what I think is kind of bizarre about this, because I'm so measured in life, like, and the fact that I can like do something that the end result is like
Is variable.
Yeah. Like there's nothing, like,
can't
we
control
were even talking about it, like in a test, like you might have an exam and you'll study and study and study, and then you'll get a result in test, but at least like you'll know what you got right and what you got wrong. Like, but this is like, you don't even know what you got wrong. Like, what'd you do? Like, was I lean enough? Yeah.
Yeah.
Could I be leaner? Yeah. But how lean is too lean? Like,
Yeah.
can I be bigger? Yeah. But like, how big is too big now? Like, this is men's physique. Like, you can't be too big, but then, yeah, it's bizarre. Yeah. So but that's the gym. That's like, we're not trying to be you know, like you're just trying to be a better version of yourself each time, you know, and that's kind of like what we should be doing every day anyway. Like every day should be a better version of yourself tomorrow than you are today, you know. And then if you just do that and take those principles of bodybuilding into your daily life, you know, like, you know, and just be a little bit better each time, that will be rewarding, like
Yes.
from very, like every angle, like, you know, your relationships to your money to your success, you know, to being a parent, whatever that is. If you just pick a little thing and just chip away, it's long, you know. I've been in the gym since I was 15 years old. I'm 39 this year. A long time in the gym.
Yeah.
A long time eating the food.
A lot of people wouldn't have even done anything in their lives for that long.
Yeah, but like, no, they do. I argue with people all the time. They do things they hate every single day for a long time, like their job.
Sure.
Most people have jobs they hate.
Yeah.
Most people I know have a job they hate. And they'll turn up over and over. They have discipline for that, for something they hate. Like, why do you have discipline for something you hate? Why not have discipline for things that you like your friends, your family, like all those things, you know? So
They probably feel like they don't have control over it.
yeah.
So they have to go to work. Yeah.
Yeah, it's interesting, but
So to pivot off that too is, so, because I remember you telling me for last year you almost dieted for a whole year.
it was 8, like, so if you include the prep part of that, it was really like 18 months of straight dieting.
18 months of dieting. Yeah.
Yeah. And then if you include the failed preps before that,
Yeah, right.
it was actually really like 3.5 years of straight
3.5 years of straight
straight dieting. Like, you know, like obviously with off season, like small windows of off season here, but
So 3.5 years of dieting. That was like what I wanted to get to initially. So you've given me, you said something really, you had a good tip for me back in the state show. You said the food will always be there. So you don't have to eat it now, you know. So that was a really good like tip to just think about during dieting. But as someone who has dieted for almost 3.5 years, nonstop, do you have any other, I guess, dietary like mentalities or mindsets you think someone who is doing a diet for the first time would really value?
yeah, I think that people expect linear results, right? And that's not realistic across all things, you know. Like you can't, like, you take the diet away, like that principle of linear result that's just not life, right? So like that, you have to get that concept out, right? So there should be phases of push and maintenance, and then push and then maintenance, and like you have to be patient. So patience is the key. Always take, especially if it's a diet and you have like a date you need to be ready for, it's going to take more time than you think. So give yourself time. Time is luxury. So, you know, you don't have to go as hard if you got time on your hands. The other thing is, if it's not, there's no date in mind, then the patience can be like take the small wins as you go, right? So break off small chunks that you can manage. So, you know, the goal might be 20 kilos of weight loss, but, you know, if you take it 5 kilos at a time, 5 kilos, stabilize, hold that, right? Yeah, like the thing is people don't like that because, like,
They want it now.
5 kilos over your whole body, you're not really gonna see. Like, you know, like what's 5 kilos? It's like once, like, you know, like a little bit from your cheek, a little bit from your butt, like, you know, like your whole body, 5 kilos, you're not gonna really see. You'll notice it, or maybe even other people might, but on yourself, you won't see it because the progress is slow, right? So people will get a bit disheartened like with that process. So, but like if you want stable, like long term, you have to do it slowly. Yeah? So you might be 5 kilos, stabilize, 5 kilos, stabilize. It might take you, like if 20 kilos is the goal, it might take you 2 years to get there, right? But in dieting for a contest, we can do 20 kilos in 10 weeks.
Yeah.
You know, that doesn't mean we're not gonna. That's not sustainable. You know.
Yes.
So same with muscle gain. Same thing. Like, you know, there's a quick way of doing it for sure. right? You know, everyone knows.
Mm-hmm.
You know, it's not going to be healthy for you. It's not going to be good, but you can do it.
Yeah. So,
But again, that's not linear too, right? So you have to accept that that process is going to be slow. So that's my big thing. Patience.
yeah.
Patience is the key.
Which is hard because we live in a world of instant, like Uber Eats, TikTok, like now Tinder, like everything's now.
Absolutely.
So, yeah.
So yeah, patience, and yeah, remembering. Also, not people live so hedonistically. Like
Definitely.
I just think it's a shame that people have to live like that, and like you just have to like take pleasure in control, like there's pleasure in hedonistic living for sure, right? Like, you know, like to like throw caution to the wind and do whatever you want. That's pleasurable, but you do that for a long time, and that's what most people most people live their life, like not thinking and just doing whatever they want, and then that gets them into trouble. Like, but you know, like taking pleasure from consistency.
Yeah.
Learning to love that. Learning to
Process.
love the process. Learning to love, you know, the journey.
Mm-hmm.
You know, that's the thing that dieting, the competing is taught me. It's not about the result is important to me, but that true mastery of self is more important, you know.
Mm-hmm. Almost wrapping up now, but there's I think there's something unique about you compared to all the other competitors I've met so far, and it's the fact that you have a family and you have a wife and a family.
Yeah.
So you also run your own dental business. You compete at IFBB level, and you have a family. So at the same time, you're also all or nothing person.
Yes.
You know, so it's not like you're just working as a dentist. You're not just training. You're doing the max of all these things.
Yes.
How do you balance these three things in your lifestyle? How do you be the best dad, the best competitor, and the best dentist?
Yeah, things like things come down to scheduling, really. Like, you know, like you have to be aware, like where your limitations are. There's only 24 hours in a day. So like, look, my approach is not like I work 6 days a week. I work long hours. I don't train in conventional times. Like, so my routine for the last forever has been train at night. So I do my day at work, come home for dinner, have dinner with my family. They go to bed. As soon as the reality TV goes on in my house, I'm out. I don't want. I'm not gonna waste my time like in my idle like reality TV stuff. So I'm at the gym. Like, there were people like, the reason why I'm so jacked is because of reality TV. So
why is that?
Because my wife watches it. I'm not gonna. I don't want to be watching it. I want to do something productive. So I go to the gym while she's watching TV.
Like, what time would that be?
So I'll hang out with her like for a little bit. That's usually when I have my pre-workout meal. So so while I'm waiting for that to digest, I'll hang out with her for a bit. And then once I feel ready to go to the gym, that's usually about 10 at night.
Wow. Yeah.
It's pretty common for 10:30. So it's pretty common for me to train till midnight.
Yeah. Wow.
And then I have my last meal, usually 12:30. I'm in bed by 1. The kids are up pretty early, so I don't do sleep well. That's one of the sacrifices. That's not the best.
Yeah. Yeah, because as someone who's looked afar, the only few times I've really seen you and your family at the shows, you have a really ideal family. Like, your kids and your wife seem like they, from what I've seen, they love you, and they support you, and I think your kids really look up to you. You know, so I think it's easy as an excuse to like neglect family when you go into prep and all that, but. You've even told me like your son is more into bodybuilding than some other people.
Like, he loves it. Like, he judges the shows. Like, he has like, you know, tell me, he usually gets the top 3 correct. Like,
and how old is he?
He's almost 8.
Yeah, so
yeah.
Okay, yeah.
But he's been around it a long time, right?
Right.
And even my youngest daughter, she's 4 years old, can do 4 man push-ups already.
Right. Wow.
So like, even the nutrition thing, like, you know, it's like, I think it's like good to demonstrate how to work hard and how to be the best self, like just to display to them, like, you know, like So it's like you're doing it for yourself, but you're also doing it like to show
It's
them like what's
your
capable,
role modeling.
what's capable. Like you can be. Like it takes a lot of work, and they understand that. Like they understand. Like I can't eat this sometimes. I can't eat that sometimes. I have to train. Like they understand. There's things you have to do to be better. They see me reading, they see me studying, they see me, that never stops,
So I think what's interesting is, because I guess like parenting is a very important thing. Like it's an important thing for me because I think like kids, like a big aspect of how kids turn out is the way their parents bring them up, right? And it seems like the way you've parented, whether consciously or not, is you just live at such a high standard, and your kids, like you're not even like, I think because a lot of like dads will be like, hey, son, you shouldn't eat junk food, and the son's like, but dad, you literally got a gut,
Yeah.
So it's almost like everything you're doing, your kids can see you're actually doing it. Like it's integrity in a way, or like you act through your actions. Or you speak through your actions.
Do as like often it's like the people like do as I say, not as I do.
Yeah, and you're not living that at all.
No. It's like you can't expect your kids to be good at school if you don't put an effort into. You can't expect your kids to be good at sport if you're not showing that you can. Like if you can't display to them what effort looks like. But that's everyone. That's you don't complain about the things you haven't worked for. And they understand that already. They understand
And they're young.
Yeah. Academically, they already understand that. Sporting, they already understand that.
So if you had a parenting tip, what would you give?
Just like be aware of what you're doing, because they're gonna copy you. So
yeah.
So yeah.
Live by
we're
example.
not perfect. No one's perfect, right? I'm sure there's a lot of things that I don't do well, but at least do your best. And I'm sure people are I'm not trying to it's just like my expectation of what it is for me is maybe different for other people than other people, but I'm sure people are trying their hardest, but are they?
Your kids are almost a reflection of that.
Yeah, are they trying?
I don't know.
Yeah, when people, I'm doing, my most favorite quote is the one from Star Wars, the Luke Skywalker says to Yoda, "I'll try, master," and he goes, "Do or do not. There is no try." So they say, "I'm trying my hardest." I'm like, that's the problem. You're trying. Don't try. Do.
Just okay, cool.
Yeah.
All right. So before we give you the final question, I don't know many dentists that treat in a very holistic way the way you do. So if anyone is looking for more of a, holistic approach to their dental health and taking care of their teeth, because as you said, it's not just your teeth, it's literally the way you're perceived at work, the way you interact with people. Where do you work at, and where can people find you?
So my dental practice is called Dental Assembly in Campbelltown. You can find me just Google Dental Assembly. You can reach me through Instagram. That's probably the easiest way to do it.
What's
if you don't feel like calling, just Dental Assembly on Instagram.
Okay.
Or my personal page on Instagram. Both of them are linked together, so you can, if you go on my personal page, you can click through onto Instagram there, to the clinic there. Yeah, I'm pretty contactable. Email, whatever. Any question. I'm kind of constantly feeding.
Your stories are really interesting. Because
I even get messages of people their kids have hurt themselves in the park. They send oh, do I need to be worried about this? And I'm like, yes, no, don't. Any question, even animal ones, just send them through. I like knowing that I know stuff. I'm helpful in certain areas, not in others. So
a lot of things, that's it. Yeah, because like you said, you don't just knowing bodybuilding. Like vet, like dental health. It's
health in general. I like it. I enjoy it. But I'm a very also I can admit when I don't know something, and who knows it more than me. So if I don't know the answer, I can usually give you that. Let you know who knows it, who can find that answer for you. So
awesome.
Yeah.
And if people want to like see your prep journey, because you're so close, man. Like even for me as a like, I guess your friend and like someone who has been watching your process, like you're actually so close. You of everyone, I think who is in the running, like you like you said before, you can actually get better. Like you can actually come in and like blow.
Yeah,
blow,
I'll do
blow,
my best. I'll try.
Yeah.
Oh, I won't try. I'll do.
You do.
Like,
Yeah.
I'll do. I won't. That's like I think the icing on the cake to get that pro card. Like it would just validate all the years of training. That's the only reward for me. I have no financial interest in it. It's just like I just want to validate my,
the work you put in.
The kid at 15 years old that didn't even think that, like being a pro bodybuilder was an option or even a thing. Mm-hmm. Like to know that you could do it. Like wow, that's
Mm-hmm. So. And they can kind of watch your journey. It's like your Instagram is Dr. Ash Abdollahi.
Yeah, Abdollahi. Yeah.
Is there any space?
Like it's Dr. Ash _Abdollahi. So just find me there. Yeah.
Cool.
But you'll see a picture of me anyway.
Yeah. And then the final question, which I ask all my guests, which is pretty much, why do you think it's important to 99 everything? So, some people just want to do work only or just family focus.
Yeah.
But for you especially, you're an all or nothing person for everything.
Yeah, because how you do one thing is how you do everything. So if you're not 99ing everything, well, if you're not 99 even one thing, you're not going to 99 anything, right? So you got to, like, again, how you do one thing is how you do everything. So if you can develop that attitude to even one thing, that will spill over to other things and other things and other things. Again, like one of my training partners when I was kind of young, he was a neurosurgeon, a brain surgeon, right? So his name's Hercules too, which is cool. He told me discipline is is a cup, and you pour water into it, right? Into a cup. At some point, the cup is full and has to spill over into everything else. So if you can fill that cup, if you can 99 that, then you can 99 everything, So.
Right. So even just pursuing one thing, it will eventually bleed into.
Yeah, because you have no choice. Like that skill you learn.
Oh yeah.
It's not drive. It's a skill.
Yeah.
Once you know you can do that.
For this thing.
We even talked about that with the podcasting, right? So it's this is kind of a newer thing for you, but like once you realized how much potential you have now, because you can discipline that, right? Like you know like how much further you can take things.
Yeah.
So like once you've taken something to the nth degree, like you can, like it's you have no choice. Like it's like it becomes a path. So.
Yeah, it's cool.
Yeah.
Awesome, man. So. Thanks, guys, for watching or for listening on the podcast. Thanks for your time again, Ash. Appreciate it, man. But yeah, guys, if you enjoyed the podcast, please give us a like on YouTube or a comment. And for the listeners on Spotify, we would really appreciate a rating. Awesome. But we'll catch all you guys next time on the next episode.
Yeah.
Peace out.